Hello, and welcome to Care Talk. My name is Laura Packard, and I am here to help answer your health insurance and healthcare questions with the experts. So please call or text in your questions at 202-838-6837, and we'll get you answers in future episodes. And also be sure to subscribe to my channel or podcast wherever you get your podcasts to get future Care Talks. And now I'm pleased to introduce Temi, the Advocacy and Organizing Director for Patients for Affordable Drugs. Welcome, Temi.
Hi, everyone. Nice to meet you all. I'm very excited to be here.
Thanks for joining us. And we're here to talk about the Inflation Reduction Act and how it finally allowed Medicare to negotiate lower drug prices. But even though this has been the law of the land for a couple years now, the drug companies, unsurprisingly, they hate it. And they have been fighting lower drug prices every step of the way. So let's start with, why are these pharmaceutical companies suing over Medicare having the ability to negotiate for lower drug prices?
Thank you so much, Laura. So, the Medicare Drug Price Negotiation Program is one of the main tenets of the Inflation Reduction Act. And it allowed Medicare, like Laura said, for the first time ever to negotiate the prices of the most expensive prescription drugs. So, that is insulin, cancer drugs, and other essential drugs. Um, the first 10 drugs were announced in the fall of 2023, and the maximum fair prices for the negotiated prices for those drugs were announced last summer, in the summer of 2024. What we saw was a decrease in negotiated price of between 32 to 78% of lower than the list prices for these drugs. So Big Pharma is currently suing because they want to protect their profits at the expense of patients. They claim that Medicare negotiation infringes on their rights, but the reality is, like, these negotiations are a common sense way to make life-saving prescription drugs more affordable for millions of Americans. These lawsuits are about preserving their ability to charge sky-high prices, not about protecting innovation or patient care. Um, they really are just trying to protect their bottom line. When the sad truth is, Americans pay between 4 to 8 times more for their prescription drugs than any other nation. So I think most of these lawsuits are just about protecting their bottom line.
So, when it comes to these lawsuits, what is the drug company's argument? Why are they saying that the Inflation Reduction Act and negotiating lower drug prices is illegal?
I mean, one of the arguments is that the Medicare drug price negotiation is unconstitutional and that it is price setting, which is categorically false. Their claims are very much baseless. The negotiations are designed to ensure fairness, and they're entirely voluntary. All of these companies, about 8 companies right now that are suing, voluntarily entered into negotiation. I think 9 lawsuits now, because the 15 drugs were just announced about a week and a half ago. Teva Pharmaceutical also entered into the lawsuit games. There are a few other arguments in kind of mixing into their lawsuit, but it's all part of the concerted effort to stop the program. And I think what we are seeing is that, like, they can wrap it in legalese and lawyer words, but basically all they're saying is that they want to protect their profits.
So, their legal argument is, we don't like it.
Yeah, basically it's unfair, and which is wrong.
And how do these lawsuits affect patients?
Like I said earlier, Medicare, we saw the first round of maximum fair prices, which will see about 9 million patients on Medicare. Medicare patients save up to 1.5 million out of pocket in the first year. We're looking at an average of a 62% price reduction. If these lawsuits succeed, seniors will be paying on average 62% more for their drugs. Millions of people will be struggling to afford the prescription drugs that they need to survive. I mean, we say this is P4AD a lot. Drugs don't work if people can't afford them. So if this lawsuit succeeds, what we're going to see is people paying more for drugs that they don't have to pay for. I think it's very, very easy to see how this can affect day-to-day Americans.
And tell us what Patients for Affordable Drugs is planning to push back against all of these lawsuits.
Thank you. We started a campaign last summer called Fight Pharma, Us versus Pharma. Our website is called fightpharma.org. We we started fighting back with about amicus briefs. We filed 3 amicus briefs and signed on to 4 more with allies. We are also mobilizing our patient advocate community, community organizations to join us in signing our petition asking pharmaceutical companies to drop their lawsuits. So we are fighting them in the courts, and we're also mobilizing on the ground with everyday Americans, asking them to drop their lawsuits. In that vein, on Wednesday at 11 o'clock in front of Pharma headquarters in DC, we will be doing a demonstration based on delivering these petitions to them face to face, telling them, with over 202,000 of us, asking them to drop their lawsuits. We will have billboard trucks driving around DC, and we'll have a boat on the water as well, basically asking them to drop the lawsuits. What I will ask your listeners to do first and foremost is go to fightpharma.org. We have the petition, it's still live. Join your names, like I said, over 202,000 people. And if you're in the DC, Maryland, Virginia area, and you have some time on Wednesday morning, come join us, make your voices heard, and ask them to drop these lawsuits.
And why did you pick PhRMA for where to deliver these petitions? PhRMA is the trade association of the big pharmaceutical corporations.
They're also like this pharmaceutical company's most powerful lobbying group, and they actually led the charge lawsuit-wise against Medicare negotiations. By delivering these petitions directly to them, we're making it clear that we're going to hold them accountable for standing in the way of affordable drugs. We're not just going to sit and let them take away a program that benefits a lot of people. 1 in 3 Americans has said that they cannot afford their prescription drugs. This is a step forward to affordability, to access, to equity. And we just want them to know that we're going to hold them accountable if they stand in the way of progress.
And realistically speaking, PhRMA is filing all these lawsuits to protect their profits. And hearing from patients, please stop hurting us, is probably not going to change their ways. But what message are you trying to send with this petition, with these events?
You're absolutely right. We can shout. We've seen that corporations don't tend to listen to little people, but we are not going to sit down and take it. We're going to send a very loud and clear message. Americans will not tolerate Big Pharma's efforts to block Medicare drug price negotiation. It is time for them to start prioritizing patients over profit. And I think what this demonstration will show is that the public is watching. If you decide not to do that, a lot of people we're going to have eyes on you watching, and we're not backing down. I think the thing is just to name, the main point is to name them and let them see that, like, Americans can see what they're doing. They're not operating in the shadows anymore. We can see what they're doing. And we are asking them to drop their lawsuits.
Yeah, I think a lot of people may not realize right now that the pharmaceutical companies that we rely on for our medications are fighting lower drug prices. And this is your chance to fight back, that we can't let them get away with this without holding them accountable.
Yeah, and I think the way P4AD historically has worked is that we amplify patient stories in the media, in the halls of legislation. And I think what I want folks to take away from this, in addition to obviously coming to the demonstration and signing the petition, is if you have a prescription drug story, if you know someone with that prescription drug story or instance, sharing your story is like a first step to taking your power back. We've heard a lot from our patient advocates who say that, like, when they share their story, they feel heard for the first time. Laura, I'm sure you've covered this in your podcast a lot of times. Navigating the healthcare system it's not an easy thing. but being able to share your story and be in community with like-minded folks with one goal, which is making healthcare accessible, making prescription drugs more affordable, that can be the first step to taking your power back and being able to advocate for yourself.
Exactly, because you have a voice. And if you are facing high drug prices, this is your opportunity to share your story and make sure that people hear about it, because the Inflation Reduction Act is a great first step. It covers people on Medicare, but there are hundreds of millions of Americans that are not on Medicare. And so the problem is not solved. We have made progress, but we have not yet reached a point where every American can afford their prescription. And that's where we need to go.
Yeah. Yeah, I think that's a very, very good line to say. Like, the problem isn't solved, but we're moving towards progress. We're making progress and moving towards progress. And the people who make the drugs that are supposed to help us live are actually trying to tie cinder block to our legs when we're marching towards progress. So being able to know that you have a voice and be in community with others is very, very helpful and very powerful in this moment.
And this may be too soon to ask you, but do you have thoughts about what negotiations for lower prescription drugs will, how that's going to work under President Trump?
Honestly, we are optimistic. I would say at P4AD, our Medicare protecting the Inflation Reduction Act and Medicare drug price negotiation is one of our top priorities. We will continue to advocate for patients across the country in the court and mobilizing on grassroots. We're very hopeful and optimistic that the president will want to continue to lower prescription drugs, as he said on his campaign trails. We're happy to work with them towards the goal of affordable care. So I think right now all we say is optimism, and if that is where they're leaning, we are happy to work with them on that front.
Thank you very much for joining us, Temi. And for the people that are listening, how can they watch the events this week outside of PhRMA headquarters?
Yes, please go to our Facebook page, which is Patients for Affordable Drugs, on Facebook, on Twitter, and on YouTube, Patients for Affordable Drugs. We will be live streaming the demonstration. If you want to share your story, you can find us at patientsforaffordabledrugs.org, but we will be live streaming the demonstration. You can watch us on Facebook, YouTube, and Twitter.
Thank you. And next, we're going to cover more of what's going on with your healthcare. And we'll start with President Trump signed a bunch of executive orders that touch on healthcare during his first week in office, from health insurance marketplace to drug prices and much more. So, Louise, can you start by covering how the rulemaking process works? What executive orders that President Trump signed that have to do with health insurance marketplace, and what does that actually mean?
Sure, yes. So a lot of what President Trump did in his first week was actually just revoking executive orders that President Biden had signed. And a lot of those executive orders had spawned federal rulemaking over the last several years. So with them being revoked, we could certainly see, no guarantees that we will, but we should certainly expect to see subsequent federal rulemaking to roll back some of those rules that were implemented over the last several years. And just to clarify, like the Affordable Care Act, for example, is federal legislation, but there are a ton of places in the Affordable Care Act where it defers to the Secretary of Health and Human Services to set guidelines and make rules and basically just implement the ACA. So a lot of what we know as the Affordable Care Act now is actually federal rulemaking that has been implemented by Health and Human Services, or in some cases the Treasury Department, over the years since the ACA was actually enacted. So undoing the ACA itself would require federal legislation, but you can make lots of changes using the federal rulemaking procedures, and executive orders are often used to provide guidance to the federal agencies. In this case, we're talking the Department of Health and Human Services, sometimes the Department of the Treasury, to propose new rules and go down that process. So the Administrative Procedures Act has been federal law for almost 80 years, and it guides how federal agencies such as HHS and the Treasury Department go about making rules. They have to follow certain protocols. And like I say, this has been the law of the land for 80 years. Congress could change the Administrative Procedures Act, but that would require an act of Congress. So the way the rulemaking process works is these federal agencies have to propose a rule and that has to be published in the Federal Register. Then they have to provide a public comment period of at least 30 days. It is usually 60 days, but 30 days is the bare minimum. Then they have to, in the final version of the rule that they publish, they have to respond to the comments that they received. They don't necessarily have to agree with the comments they received, but it does all get published. And then for significant rules, there has to be at least a 60-day delay between when the final rule is published and when the rule is actually implemented. So this is why, for example, over the last 3 administrations, we've seen changes to the rules for short-term health insurance is a really good example of this. These rules stem entirely from federal rulemaking. The last 3 administrations have all changed the rules, but in every case, it's been like at least a 7 or an 8 month process from when they proposed new rules to when those rules actually took effect. So just to give you an idea of some of the rules that stemmed from Biden executive orders that have subsequently now been revoked by President Trump, we have extending postpartum Medicaid coverage out to a year for new moms, the extended open enrollment period in the marketplace, giving people until January 15th to sign up for coverage. It used to be December 15th. Lowering maximum out-of-pocket costs for health insurance plans. The rules that were implemented in 2022 reduced those a little bit. The low-income special enrollment period for people with income up to 150% of the federal poverty level, getting to enroll year-round. That was federal rulemaking that stemmed from a Biden executive order. Fixing the family glitch, which allows people to sign up for marketplace health insurance and get a subsidy if they're offered family coverage from an employer, but the coverage for the spouse and kids is expensive. And as I mentioned before, the stricter short-term health insurance coverage rules. That's just a handful, but those are all examples of rules that we have seen in the last few years that all stemmed from Biden executive orders that have now been revoked. So we could certainly see new proposed rules in the coming months to change any or all of those things I just mentioned. And the next open enrollment period for marketplace coverage doesn't start until November. So there is plenty of time for this administration to propose rules, go through the comment period, and finalize rules before the start of the next open enrollment period. So people could certainly see changes there, but by the end of the year for sure.
Thanks. So I think what you're saying is that Trump has signed a bunch of executive orders that revoked Biden executive orders, but the rulemaking process takes time and there are no immediate changes to the health insurance marketplaces.
Correct. Nothing has changed about the health insurance marketplaces right now. Nothing has changed about special enrollment period access. But that is an example of something we could see. For example, we could see rulemaking this year to tighten up access to special enrollment periods. That's something to be keeping an eye out for. And we certainly could see changes before the next enrollment period begins, which is, for most people, your next time to access marketplace coverage won't be until November anyway. So changes that happen between now and November could certainly affect access to coverage that people have for next year.
Thank you, Louise Norris from healthinsurance.org. And now I would like to talk about the other executive orders and actions that President Trump has taken that affect our healthcare. And to tell us what happened and what the effects will be, welcome Diane Archer from JustCare and Social Security Works.
Thank you, Laura. I want to start by saying probably what everybody needs to be focused on now are potential changes to Medicaid cuts to Medicaid that can affect the more than 70 million Americans in the program. People on Medicaid represent nearly 25% of our population. And the Trump administration is supporting initiatives in Congress right now for a reconciliation package that would be soon, that would include cuts, drastic cuts to Medicaid that would be used then to pay for big tax cuts for millionaires and billionaires. So if you know somebody, if you care about Medicaid, you should be contacting your members of Congress now and saying, please do not sign on to any reconciliation package that includes cuts to Medicaid. In terms of executive orders that also have consequences for folks, although again, not nearly as dramatic as a Medicaid cut that is in the works. There is the Trump administration's firing of HHS Inspector General, the HHS Inspector General, as well as many other Inspector Generals. The Office of the Inspector General, for those who don't know it, is charged with stopping fraud and abuse in the Medicare and Medicaid programs. And in the last several years, that office has found rampant fraud, waste, and abuse, particularly in Medicare Advantage, and shined a spotlight on the tens of billions of dollars in annual overpayments to insurers and widespread inappropriate delays and denials of care to people enrolled in Medicare Advantage. So the lack of an Inspector General in the Department of Health and Human Services bodes poorly for people in private Medicare and Medicaid plans, because there is nobody watching the providers and the insurers to make sure they're doing right by their enrollees. And there's plenty of evidence that some of them are really not. So we can't combat insurer and provider bad acts without a functioning Inspector General's office. I want to add here that experts say it's illegal for the president to have fired the Inspector General. The law requires the president to give 30 days notice to Congress and a sound rationale for so doing. But he did so anyway, and that's obviously terribly concerning. The president's executive orders also eliminated 3 Medicare models that Biden had proposed. They hadn't taken effect, but their goal was to reduce prescription drug costs for people. And they included a $2 copay on many generic drugs. Right now, it's just not clear where the president stands on lower drug prices. He has, in the past administration, said that we shouldn't be paying in the US higher prices than people in other wealthy countries. And as Louise said, we're paying many, many times more, but it's not clear that Trump is going to stand by that. So that, again, is something that you should be going to your members of Congress and saying, we do not support high drug prices. We should be paying no more than people in other industrialized countries. And the negotiated drug prices in Medicare should be extended to all drugs and for everybody in the country. The vast majority of Americans support this, and we should make sure that members of Congress know that. The last executive order I'll speak to is the one that withdraws the U.S. from the World Health Organization. And that one is also very serious because the government relies on the World Health Organization for public health preparedness. The World Health Organization relies on US dollars to be able to do its work. And it's also concerning because technically we are not allowed to withdraw from the World Health Organization without a year's notice. And so it's not at all clear how things will shake out there. I actually lied. I want to say one more thing, which is the president and the administration also froze a lot of activity at the National Institutes for Health. And that has put scientific research kind of in limbo right now. As some of you may know, the NIH funds a lot of the basic research that goes to all the new drugs that are life-saving drugs that the pharmaceutical manufacturers end up bringing out. So the NIH works in partnership with private companies to make sure that we're getting critical drugs out to save people, like HIV treatments and life-saving hepatitis C vaccines. And right now, it's not clear what's happening at the National Institutes of Health. So there's a lot to be concerned about and a lot to speak to your members of Congress about, to just say we need to ensure everybody in this country has affordable access to care, including prescription drugs, and that they're protected from bad actors in the healthcare marketplace.
Mm-hmm. And I just read that NSF, National Science Foundation, has also paused their grant review process. And we don't know how long these pauses are going to last. And we also don't know how much research will be lost, because if postdoctoral students aren't funded, they may move on to other careers. You know, we know that there will probably be a brain drain of people that, if they can't get funding to continue doing their research to invent new cures. And you know, if the major grant making organizations for medical research in America are frozen, and we just don't know how long that's going to last. So that is something to be very concerned about and pay attention to, because lives are at stake with that. And our next question is from Lee on Threads, who says that my brother has been on Ozempic for about 2 years. He's lost over 70 pounds and his A1C level is now around 6.5, which is good. He pays over $1,000 a month for insurance and has a $7,000 deductible. He's been paying about $90 for a 3-month supply of Ozempic. But just learned that starting in April, it's going to go from $90 for a 3-month supply to $2,800 for the same drug. Louise, can you explain maybe what's going on?
Sure. Unfortunately, this is happening quite a bit with health plans. I'm not sure where he gets his coverage, but we've seen this with some state employee health plans. North Carolina did this for their state employees last year. Colorado is doing the same thing later this year, where they're cutting off coverage for GLP-1 medications that are being used for weight loss. They will still cover them to treat diabetes, to treat heart conditions that they're approved to treat, but are increasingly saying they won't cover them for when they're prescribed for weight loss. And some commercial health plans have done the same thing. Some employers have decided to do this. There is good evidence that losing weight results in long-term lower medical costs, but unfortunately our health coverage system is very fragmented, and most people don't stay with the same health plan for years and decades on end. And so if a health plan is spending a lot of money right now to cover a high cost medication to help a person lose weight, that health plan might not see the financial benefit of that 20 or 30 years down the road, when that person has lower medical costs due to a lower weight than they would have otherwise had. So that's sort of the crux of the problem. And we are seeing what you're describing here, where basically $2,800 for a 3-month supply sounds like basically the retail cost. So it sounds like the plan has said they will no longer cover Ozempic. It's possible that they would still cover it if this patient is diagnosed with a cardiovascular condition or diabetes, in some cases obstructive sleep apnea, for which the medication is prescribed. So it's possible the patient could talk to their doctor and see if maybe those weren't in the notes originally, if the patient has one of those conditions. It would be possible to appeal to see if maybe the patient does actually meet the health plan's conditions for covering the drug. It's also possible that the plan might cover a different GLP-1, but not Ozempic, in which case, again, this is an issue to discuss with the doctor and see if anything else would work that might be covered. Patient assistance programs can be really helpful. They're usually income-based and have various parameters that the pharmaceutical companies control. So for a person whose health plan doesn't cover an expensive medication, they can speak directly to the drug manufacturer and see if there's any assistance available for them. One of the things that Temi had mentioned earlier in her part of the show was talking about the negotiated prices for drugs under Medicare Part D. And one of the drugs that was just announced on the list is Ozempic that would take effect in 2027 under Medicare. Obviously, we do not know how the drug negotiation process is going to go under the Trump administration Health and Human Services, but Ozempic is on that list. Experts disagree on what will be the impact for people on commercial health insurance if Medicare imposes lower prices for the drugs on these lists. Some people say they think it would actually drive up prices for people on commercial insurance as the manufacturers try to recoup their costs. But other people point out that oftentimes where Medicare goes, private health insurance follows. And so it's possible that this could have an effect of reducing prices for people on other plans. But again, this is not until 2027, assuming everything stays as is with the current negotiation process, which we do not know exactly how that will work.
Thank you, Louise. And Diane also notes that the FDA approved the first generic in this class of medications last month at the end of December. So there may be a generic available that may or may not work for you and that could be cheaper. And thank you for all of the speakers and all of the audience for joining us today for Care Talk. We're going to continue to cover all of the healthcare news from this administration and how it affects your care, and have guests that talk more about healthcare issues. So please text or call in your questions at 202-838-6837. We'll get you answers in future episodes. And be sure to subscribe to my channel or podcast wherever you get your podcasts. This is Care Talk.